Nagaland is gearing up for a massive 2-month drive to raise awareness about HIV and sexually transmitted infections. The Intensified IEC Campaign 2.0 will be launched tomorrow, August 12th, in Kohima, coinciding with International Youth Day. This was announced during a press conference at the Nagaland State AIDS Control Society Office Conference Hall. The campaign, under the National AIDS Control Organization, will cover 520 villages across all 11 districts of the state. The outreach will include village meetings, school programs, special testing camps, folk performances, flash mobs, and social media campaigns. Last year, the campaign reached over 1,15,000 people in 789 villages. This year, organizers plan to go further, using theme songs, street plays, and influencer-led messages to tackle stigma and promote testing. The launch event at NBCC Convention Centre will see more than 3,400 students participating. NSACS has appealed to local leaders, organizations, and youth to actively support the campaign. नागालैंड में HIV और यौन संचारित रोगों के प्रति जागरूकता फैलाने के लिए 2 महीने का विशेष अभियान शुरू होने जा रहा है। इंटेंसिफाइड IEC कैंपेन टू डॉट शुभारंभ कल 12 अगस्त कोहिमा में अंतर्राष्ट्रीय युवा दिवस के अवसर पर किया जाएगा। ये जानकारी नागालैंड स्टेट एड्स कंट्रोल सोसाइटी के कार्यालय सभागार में आयोजित एक प्रेस कॉन्फ्रेंस के दौरान दी गई। राष्ट्रीय एड्स नियंत्रण संगठन के अंतर्गत चलाया जाने वाला यह अभियान राज्य के सभी 11 जिलों के 520 गांवों को कवर करेगा। इसमें गांवों में बैठकें, स्कूल कार्यक्रम, विशेष जांच शिविर, लोक नृत्य, फ्लैश मॉब और सोशल मीडिया के माध्यम से प्रचार प्रसार शामिल होंगे। पिछले वर्ष इस अभियान के माध्यम से 789 गांवों में 1,15,000 से अधिक लोगों तक पहुंच बनाई गई थी। इस वर्ष आयोजकों का लक्ष्य और बड़ा है। गीत, नुक्कड़ नाटक और सोशल मीडिया इन्फ्लुएंसर्स के जरिए जागरूकता बढ़ाना और जांच को बढ़ावा देना। NBCC कन्वेंशन सेंटर में आयोजित होने वाले शुभारंभ कार्यक्रम में 3,400 से अधिक छात्र भाग लेंगे। NSACS ने स्थानीय नेताओं, संगठनों और युवाओं से इस अभियान में सक्रिय सहयोग की अपील की है।
Formally to be launched tomorrow at 11 o'clock, following which activities will start. Similar activities will start in all the districts. And like last year, we look forward and we intend to reach out to all nooks and corners. So therefore, we have targeted altogether 520 villages. 520 villages, 376 schools, 110 colleges, and so forth. So our activities will be, yes, awareness activities, and we will also be having some special activities in the form of flash mobs, in the form of folk performances. So precisely again, folk performances, we will be staging about 100 folk performances with about 50 flash dances. And precisely our target is for about 5,200 door-to-door campaigns, household visits, which maybe at the end of the day, we look forward to achieving more than our target also. It was detected in our state, Nagaland, back in 1990. Back then, the ICMR, that is the Indian Council of Medical Research Bureau, had kind of estimated that Nagaland would be having a population of about 2,500 injecting drug users in our society back then in 1990, with a prevalence rate of 50%. Prevalence rate is as the name implies, the prevalence rate of HIV in our society. And for your information, that first case was from the community of injecting drug using community. So as I said, Nagaland was estimated to be having a population of 2,500 with a prevalence rate of prevalence rate of 50%. Following that, a formal survey study was done in our state by ICMR in 1994, during which the prevalence rate was found to be 39%. So back then and now, why I'm saying this is also to take inspiration from the fact that the prevalence rate has made a substantial decrease amongst the IDU community today. Today, the prevalence rate in our state stands at 2.5, precisely 2.53. So it has come down from 39% to 2.5 today. Now, in some states, such as Punjab, Assam, HIV transmission, the maximum route of transmission is through the injecting drug community, IDU. But in our state, it's through the sexual route, same sex, through the sexual route. So precisely, it's about 87% of transmission is through the sexual route. Whereas the transmission through the injecting drug use is limited, I would say, to something like 8.3%. So again, I would also like to apprise you of the fact that unlike most of the Northeast states, the trend of HIV transmission is, I would say, more or less stabilized in our state.
Starting from tomorrow, at the moment, under National AIDS Control Organization, we have 36 state-controlled societies. So across the country, the launching will happen at state level. NACO envisions that through this campaign, we will reach the maximum number of population, maximum number of ages. Last year was the first edition of the campaign from 12 August to 12 October. This year is the second edition. Last year, pan-India, we were able to reach 1,24,257 villages, out of which, as per your press note, Nagaland contributed 789 villages. So this year, we are trying to cover the uncovered villages of last year. So 520 is what we're targeting to see villages, where village level meetings will happen, school outreach will happen in that school, and door-to-door campaign in that village will happen. So
we were just working on the data also. Unfortunately, we are seeing a steady decline, but we are still the second highest in the country. That's very worrisome. And another is that we also see the route of transmission. 85% is through the unprotected sexual route. So the infection is happening through unprotected sexual route, 85% of infections amongst those who are positive. And then about 8% are from infected needle syringe, that is amongst the injecting drug users through that route. And then another 5% through an infected parent to child, parents who are not on treatment. If parents are on treatment, then infection to the child is also protected. So that is, those are some of our concerns which needs a collective response, because it's not only to the targeted, we cannot say it's a targeted or marginalized populations that get the infection, no, because the epidemic is very generalized. At the same time, the sexual route of transmission, unprotected sexual route of transmission is very high. So that's where we all need to come together and make sure that everyone understands the route of transmission and get themselves tested as well.
When we see one of the top indicator is to have no new infections by 2030. As per NACO's data, Nagaland has achieved 37% decrease in new HIV infections since 2010. So somehow the prevalence rate may be not very, maybe static, or may not be dropping down so much. But one of our main concerns is also to stop new HIV infections. For those who are living in HIV, treatment, promotion of treatment and services that are provided by the government through our hospitals are promoted. But one of the main objectives is also to reduce new HIV infections. We have achieved around 37% decrease in new infections since 2010. So that is also one thing that we are looking at, so that the reduction is not just 37%, but by the end of, by 2030 or by after 5 years, at least the reduction of new infections come down drastically. That is something that we are looking at. And that is why we are intensifying a lot of our campaigns targeted towards it.
Present in the state, and are there enough to cater to the patients suffering from this disease?
We have 13 centers in all the districts except the new districts. And what was the other question?
Like, is there enough to suffice the patients?
For now, district-wise, it is enough for now. We have not increased, but we have not asked for increasing the number.
And based on the need of the, for example, the PNHIV population of a certain district, when there is a need to enhance the services, we have something called the LEC, Link ART Center, through which we facilitate the treatment, the ART.
So these are we don't open new centers, but the existing health centers like CHC or a hospital or even PHC can cater to dispensing medicines, treatment to the patients. So we're not opening new centers, but we're linking to the existing services.
And another thing which I would like to apprise you of is on the lines of what our IEC had mentioned. Based on the SDG goals, and under the aegis of NACO, National AIDS Control Organization, the Nagaland NSACS is also working towards achievement of the 395s. The 395s are, the first 95 has to do with all HIV infected people in the society are to know their status. To know their status as in whether they are HIV positive or negative. So that first 95 target, that first 95 population of people knowing the status are to be brought under ART treatment, antimicrobial therapy. So at least 95% of that population will be brought under treatment. And the third 95 goal is, having brought this 95 under treatment, the goal is for them to achieve the viral suppressed status, where the virus is no longer visible in their blood during investigation. So there is something called U equals to U. So when the virus is no longer detectable in your blood, meaning you will no longer transmit the virus to your sexual partner or your injecting needle sharing partner, and so on and so forth. So the 395s is what we are working